the way to look at it is to see, is to actually share my experience uh, of my 37 years of practice. I, you know, starting off as a young doctor, well, I started off extremely scientific. I had to, because that is what I was taught, and that is all that I knew to take care of people that are sick. And it was safer and wiser that I go that way. But as I practiced, as the years went by in my practice, I started seeing that everything was not, that the healing and recovery of patients was not always 100% scientific. I also discovered that I could learn things from the cleaner or from the junior staff. So I discovered lots of things as I aged in the practice. But yeah, one of the things that I discovered was that the recovery of human being is not as straightforward as repairing a generator. You know, if you're fixing a machine, it's that is purely scientific. Um, but human beings have other components to them, and that makes and that has to be taken into consideration for their healing. In my understanding of human beings, the human being is made of the flesh, the heart, the mind, and of course the soul, which is the spirit. Now, this combination makes the human being complex, and it makes treating the human being not as straightforward as fixing a generator, for instance, or a car. Now, these are factors will come to play in the recovery of of a patient. If a patient has emotional problems and you treat the patient physically, the patient will not recover completely. If the patient has confusing beliefs, which is spiritual, and you give him medications alone, you would not have completely treated the patient. And so, in treating a patient, you have to consider all these factors of the mind, the heart, the body, and the soul in treating a patient. In fact, the World Health Organization has determined that for someone to be completely healthy, the person has to not only be healthy in the body, but even spiritually. It came late in the definition of health by by the World Health Organization, but now the World Health Organization identifies uh, the spiritual aspect of the human being. So going back to the topic, the doctors believe in miracles. Well, the issue is if somebody has is going to recover, there is input from this other from every part of a person. If the body is sick, the mind and the heart and the soul can augment the recovery of a person. And the mind, the heart, and the soul, they're invisible. You don't see it. They can complement the effort of the body. I'll give you an example. Someone who can't even jump a 4 feet fence on a normal day, if he's pursued by a lion and the fear of the lion and his desire to survive against all odds may jump a 6 feet fence. Now, technically, when you look at him, his body, his build, it's not possible for him to jump a 6 feet fence. And he himself will tell you after jumping it that he's surprised I was able to do that. Well, physically, he can jump 4 feet, but a combination of his mind, his heart, and his soul coming in to assist the body gave him an additional 2 feet for him to, uh, you know, jump the fence. So it's the same thing. When the patient is very sick and has an illness that um, the likelihood of survival is extremely low, prognosis is very poor, and basically all the health workers are walking away, and they give the patient a few days, a few weeks, a few months to survive, which actually have scientific basis. And then they come, maybe they give the person a week, then they see the person is still alive a month, 2 months, 3 months, 6 months. You know, it's probably it's a miracle, because scientifically he should be dead in a week, but he's still alive 6 months, 1 year, and so on and so forth. So what exactly happened? It's a miracle. It's a miracle. And it's a miracle because the physical and scientific basis, you know, do not exist in the survival of this person. Probably what the person did was to draw on the other aspects of his being, as his heart, his mind, and his soul, to come and help the body. And if these three are in agreement and they work very well, they can actually come in to lift up the limping and dying body, for it to survive. A similar thing happened during the HIV pandemic at that time, epidemic rather. It wasn't pandemic, but at the very early stages of the HIV infection, they discovered that there were some people who had HIV infection and they were not sick. Later on, it was investigated though, and discovered that these people had intense immune system, and they were able to counteract the HIV infection, which scientifically, with the kind of load that they had, they were meant to be dead. So I think that in my own belief is that there are miracles in the health profession. I had seen a case in which a woman was very ill, extremely ill, and the son and the husband were actually discussing what they would do, about her burial, about her funeral. I heard them whispering at the door. They were very concerned about her condition, and but I refused. I don't give up on patients. Patients will die if God says they should die. They will not die because of my ineptitude or incompetence or lack of faith or weakness or things like that. I fight like a warrior to the end. I rather get shot with the gun in my hand than walk away and be shot at my back. So I fought for this woman. I refused to believe that she would die. And I fought. And then they went home. You need to see the shock on their face when they saw this woman sitting at the edge of the bed, eating her meal. They were shocked. They looked at each other. They were shocked. Of course, the woman did not hear their conversation, but I did. And I cornered the son, who happens to be my very good friend. And I said, "Did you see? Can you see her now? I heard you guys saying such and such. My brother, you can't really blame us. With the way she was, her condition, there's nobody who will be thinking of things like that." I say, it's probably true. Her recovery was a miracle. It was a complete miracle. And till today, we still talk about it. Because even I myself, while working and fighting for her, I also feared for her life as well. So there are miracles. And any doctor will tell you that if he's humble, in nature, he will be able to attest to the fact that there are miracles in the profession. There are lots of miracles. There are cases I've heard of people that have been sent to the mortuary, certified dead, and sent to only for them to be thumping in the drawer, the refrigerator drawer of the mortuary, and to be brought out, you know, alive. So we do have miracles, and that's why any good doctor will, do not give up on any patient, because you don't know those who can turn around against great odds. You just keep on fighting for every patient to the very end. And there are people who will die, and they will die. But let it not be out of cowardice, weakness, or lack of faith on the part of the health practitioner.